So this session is about the standards, and the AMC standards are at the heart of our accreditation processes, and they're at the heart of every accreditation decision that the AMC makes. And sometimes there's a bit of a misconception that the standards were imposed by the AMC, and actually that really isn't true. What the AMC, the board, the Medical Council New Zealand, medical schools and other stakeholders who engaged with us in their development think are really important in protecting and promoting high quality medical education in Australia. So in that respect, they are really our shared articulation of our collective learning and of our values. So practically, they're arranged into 8 standards, which cover situational analysis and context, we call it. And Jeff talked a little bit about this is about where the school and the program sit within the university, within the community, and how the program is governed. They're about the intended aims and objectives of the program in terms of the nature of the graduates that they are graduating. Clearly, it's about the curriculum content. It's also about how this content is delivered and the strategies, the learning strategies that are employed locally. And it's about how that content is then assessed. And then increasingly, we're focusing on the monitoring and evaluation of the program, and how do you know as a medical school that you are meeting the objectives that you have set yourselves and that you are graduating doctors who are safe and professional practitioners. So they are deliberately a mix of both process and outcomes. They're also intentionally high level to support innovative, or you might say diverse, approaches. So there are many ways to meet these standards, and that will take into account the particular qualities and experience of the local community in which the school is sat, the sort of particular availability and the mix of health services that are around you, and also the special ethos of the university in which the medical school is sitting. So the standards really need to be interpreted both within the context of the school, its community and their aspirations, and also with reference to the underlying rationale for the standards, which really reflects the broader community's aspiration for Australian medical education, and also that really important consequence of accreditation, which is registration as practitioners of your graduating cohorts.